Yesterday, Gautam, I guess, Gautam or Govardhan, asked like what are vacuates. Okay, I will show you today one small video about vacuates. Okay, so we'll just watch it. So that is for information purpose. Okay.
This short video gives a brief introduction to the more commonly used blood bottles and blood tests. It's intended to help you understand which bottles are used for which tests, so that you can choose the appropriate equipment when you land on the wards. We're trying to give generic information, but don't forget equipment and protocols may vary between different trusts. The purple top bottle is used for haematology tests. The most common of these is the full blood count. This includes hemoglobin, which is an important investigation in numerous scenarios, including blood loss. Platelets, which if depleted can result in increased bleeding risk. And white cell count, which is typically increased in infection. The purple bottle is also used for other tests, including HbA1c, which is important in the assessment of diabetic blood sugar control. The gold top bottle is used for a range of biochemistry tests, including urea and electrolytes. This gives values for sodium, potassium, urea, and creatinine, used for assessing kidney function and detecting electrolyte derangement, for example, hyperkalemia. Other tests include liver function tests, C-reactive protein, bone profile, magnesium, lipids, thyroid function tests, and cardiac enzymes. The same bottle is also used for various more specialist endocrinology, oncology, toxicology, virology, and immunology tests. The blue bottle is for hematology tests to assess the clotting system. Coagulation screen includes prothrombin time, activated partial thromboplastin time, and fibrinogen. INR is important for monitoring warfarin therapy, and D-dimers are useful in the diagnosis of deep vein thrombosis and pulmonary emboli. The grey top bottle is used for two specific biochemistry tests: glucose, which can be a fasting or a random value, and lactate, which can be raised in any condition causing tissue hypoperfusion, for example sepsis or acute ischemia. Pink bottle is used to send a blood sample to the transfusion lab for patients who may require a blood transfusion. Group and save or cross-match can be requested. Group and save determines and stores the patient's blood group, so blood can be ordered swiftly if needed. Cross-match refers to the process of ordering blood for the patient. Typically, the bottle must be labelled by hand at the patient's bedside after confirming the patient's details, but your trust will have specific guidelines which you should adhere to. Blood culture bottles are used to send samples to microbiology for culture, to isolate organisms and enable targeted antimicrobial therapy. Protocol varies between trusts, but you may be required to fill more than one bottle. Some trusts require 2 samples to test for both aerobic and anaerobic organisms. An aseptic approach is crucial to avoid contamination. All of the tests described so far can be performed on venous blood samples. An arterial blood gas sample is typically taken at the wrist from the radial artery. This test provides values for pH, oxygen content of blood reported as PO2, carbon dioxide content of blood reported as PCO2, bicarbonate, and basic cess. Arterial blood gases provide important information in acutely unwell patients to allow assessment of illness severity, clarify the diagnosis, and guide management. This test is collected in specific syringes and must be taken to the lab within about 20 minutes of collection for accurate processing. We hope this video has improved your familiarity with the equipment we have discussed. Hospital labs are always happy to help, so don't be afraid to call them if you need any advice.
Okay, so now I believe that you got sufficient information about vacuates.
Yes, sir.
Okay, what colored bottle is used for determination of electrolytes? Evacuate, what colored evacuate is used?
Yellow color.
Yellow color, yes. Okay, so the major advantage of using evacuate for collection of blood is for separation of serum is that is it avoids contamination. It is a specially designed bottle to collect the blood so that you can avoid contamination, and there are protocols that avoid confusion also. Just by looking at the cap, you can predict like what possible tests the doctor might have been advised for the patient. You can separate it, correct? So that is one of the advantages of using vacuates. So now we will continue with the class. In your next class, we will also discuss about separation of serum. Okay, how serum is separated, that we will discuss as part of your practicals. Okay, so we will have animations. So now we will continue with your electrolytes chapter. Share the screen now. I am audible, right? I am audible to everyone?
Yes, sir.
No disturbance? My voice is clear?
Yes, sir.
Okay, so in your last class, we discussed determination of electrolytes. We will quickly recall what we discussed in your previous class. Okay, so these electrolytes, most of the electrolytes like sodium, potassium, calcium, and chloride can be determined by ion selective electrode technique, that is ISE technique. It is a potentiometric technique. So here, so the ions can be, that is the ions create an electrical potential. So that potential can be measured by voltmeter. Higher the concentration, higher will be the change in the electric potential of the electrode. So this change in electric potential of an electrode by the particular ion like sodium, potassium, calcium, chloride can be quantized. So, and the concentration of the ions can be measured based on the change in the electric potential. Okay, so we discussed about potentiometry and different type of electrodes that are used, and glass membrane electrode is most widely used electrode. There are other electrode as well: solid based electrode, liquid based electrode, compound electrodes. And so evacuates are used for the collection of sample, and most commonly used combination is like lithium evacuates, so which contains lithium plus heparin. Heparin is an anticoagulant. So sodium, we discussed determination of sodium by ISE method. Determination of aldosterone, so that is carried out by so determination of aldosterone. So this is determined by LCMS method, in fact. Okay, and potassium is determined by ISC method. Calcium is also determined by ISC method. Chlorides can be determined by ISC method. Bicarbonate, so the method is different here. So the bicarbonate can be determined by photometric method, and urine chlorides are also determined by photometric method using flame photometer. Okay, so today we will discuss about replacement therapy, electrolyte imbalances. What happens when there is when our body tend to lose more amount of electrolytes, or when our body fails to excrete the electrolytes and which accumulate. Okay, so hyponatremia is a condition where sodium levels are lesser than the normal, and hypernatremia where sodium levels are more. Similarly, hypokalemia, so potassium level, hypo and hyper refer to potassium level. Hypo and hypercalcemia refer to levels of calcium. Hypomagnesemia and hypermagnesemia refer to levels of magnesia. And hypophosphatemia and hyperphosphatemia refer to levels of phosphate in the serum and urine. Okay, so there are four major physiological ions and electrolytes that are used for replacement therapy, that is sodium, potassium, calcium and chloride. So what is the aim of this replacement therapy, or what we call it as electrolyte replenishment therapy? So it helps to restore the volume and composition of the body fluids to normal. Okay, so once so that is when more amount of fluid is lost, more amount of electrolytes are also lost. Okay, when the electrolyte concentration rises, what happens? Water accumulation also rises. So these are interrelated to each other, that is water and electrolyte levels are interrelated to each other. Okay, so decrease in volume contraction, so it impairs the circulation, so that is a very life-threatening condition. So that is why, so the electrolyte replenishment should be done at a very immediately once we detect any loss of electrolytes or fluid. Okay, so if there is excessive loss of blood, if the blood volume decreases, what happens? Cardiac output falls and integrity of microcirculation is compromised. Okay, in case of moderate loss of electrolytes, so an infusion of isotonic sodium chloride solution is preferred. What is isotonic solution? Have you heard about the term isotonic? What is isotonic solution? Isotonic solution means a solution whose pH is same as that of the body fluid where you are administering. Like isotonic solution for eye will be different, and isotonic solution for ear will be different. Okay, isotonic solution for eye is, that is, it should be compatible with the lacrimal secretion of eye. So isotonic sodium chloride refers to 0.9% weight by volume sodium chloride solution is considered to be isotonic sodium chloride solution. So this is preferred in case of moderate loss. In case of extreme conditions, intravenous therapy at the ratio of 100 ml per minute for the first 1000 ml, so has to be considered necessary for successful treatment of in extreme loss of fluids in case of cholera, where there is continuous loss of fluid through dysentery and vomiting. Okay, and a general rule is to replace 1/2 of the estimated volume loss in the first 12 to 24 hours of treatment. So because in the first 24 hours, if you are not going to replace the fluid, then what happens? The cells will shrink and starts dying. Okay, so this first thing is sodium replacement. So IP limit for sodium chloride, that is so our Isotonic solution contains 99.5%, not less than 99.5% of sodium chloride and not more than 100.5% of the calculated with reference to dried substance. Okay. It should not contain any added substances. So this occurs as a colorless cubic crystals or white crystalline powder, and it is having saline taste. Okay. It is freely soluble in water and slightly more soluble in boiling water. Okay, it is soluble in glycerin and slightly soluble in alcohol. So these are the properties of sodium chloride that should be used for IV purpose. Okay, so this is used as a fluid and electrolyte replenisher, and in the manufacture of isotonic solutions, flavor enhancer. Okay, so isotonic solutions are used in wet dressing for irrigating the body cavities or tissues, and hypotonic solutions are administered for maintenance of therapy when patients are unable to take fluids, nutrients, or orally for 1 to 3 days. So hypotonic solutions means, so the concentration of the sodium chloride will be less than 0.9% weight by volume. Okay. Hypertonic solution means the concentration of sodium chloride will be more than 0.9% weight by volume. So hypertonic solution or injection are used when there is loss of sodium when the loss of sodium is very excess. Okay. What are the official preparations of sodium chloride that are administered in hospitals? Sodium chloride injection IP. So this is a sterile isotonic solution. Isotonic solution means 0.9% sodium chloride weight by volume in dissolved, that is sodium chloride will be dissolved in water for injection, specially prepared under very aseptic conditions. It contains not less than 0.85% and not more than 0.95% weight by volume of sodium chloride. So it should not contain any antimicrobial agents or preservatives. It is clear colorless solution with pH between 4.5 to 7. Okay. Sodium chloride hypertonic injection, that is hypertonic saline. It is a sterile solution of sodium chloride in water for injection. It contains not less than 1.52% and not more than 1.568% weight per volume of sodium chloride. See here, it is hypertonic, so the concentration should be higher than 0.9%. So here it is usually 1.52 to 1.68% will be the concentration of sodium chloride weight by volume. Okay, again it should not contain any preservatives or antimicrobial agent. It is clear colorless solution and the pH ranges between 5 to 7.5, whereas here it was 4.5 to 7. Since it is an hypertonic solution, the pH will be little bit at the higher end because it contains more amount of alkali. So it should comply with the test for pyrogens. I think you might have studied in pharmaceutics in parental chapter what are pyrogens. Pyrogens means those are bacterial remains. It might be cell death or excretory product of bacteria or viruses, and they will be very microscopic, and if they are injected it will cause fever or rise in temperature. Okay. So compound sodium chloride injection, so it is also called as a ringer injection. It contains a combination of isotonic solution, hypotonic solution, okay, isotonic solution and hypotonic solution, and also it contains 0.03% to 0.36% of calcium chloride in water for injection. So again, it does not contain any preservatives. Its pH ranges between 5 to 7.5. Okay. And one more preparation is sodium chloride and dextrose injection is also administered. So this is a sterile solution of sodium chloride. It contains and dextrose in water for injection. It contains not less than 95% and not more than 105% weight by volume of stated amount of sodium chloride and dextrose. So here you have different combination of sodium chloride and dextrose injections. So this is prepared as per the requirement. So the doctor or clinician can decide like how much of sodium chloride and dextrose can be given. So that is more than 0.11% sodium chloride is used at various concentration, and most of the time dextrose is used is 5%. Okay, most of the time dextrose that is used is 5%, and you can also use 0.9% up to, that is normal saline sodium chloride, and dextrose can be used from concentration ranging from 2.5 to 10%. Okay. So again, this is also clear, colorless or faintly straw colored solution with pH ranging from 3.5 to 6.5 depending upon the concentration of sodium chloride and dextrose. Okay. So the next thing is potassium replacement. So potassium chloride molecular formula is KCl and molecular weight is 74.56. So it should be 99% pure at least if it has to be used as in for parental purposes. So and calcium replacement, for calcium replacement usually calcium lactate is used, that is calcium salt of lactic acid. Okay, so molecular weight is 308.30 when it is in the pentahydrate state, that is here it will be 5H2O. Calcium chloride contains not less than 97% and not and not more than 103% of calcium chloride dihydrate. So it occurs as white odorless powder. Okay, if you are using pentahydrate, if you are going to heat at 120 degrees Celsius, what happens is it will lose all the water. So this is soluble in water and practically insoluble in alcohol. So this is mainly used in the oral treatment in case of calcium deficiency. So official preparation, Ringer's injection USP. So 0.33% of calcium chloride dihydrate is given. Along with that, various concentration of sodium can be sodium, potassium, calcium and chloride is used. So a combination of these electrolytes is called as Ringer's injection. Okay, and lactated Ringer injection contains calcium chloride, sodium, potassium, calcium and also lactate. Okay, so immediate treatment for dehydration is ORS, what we call it as oral rehydration salt. It is available as an OTC medication in all medical stores, and it can be sold in general stores also. So it usually contains a combination of electrolytes which can be dissolved in water and taken orally. Okay, so this is used to supply water and electrolytes in amount needed for maintenance as soon as intake of usual foods and liquids is discontinued. So this is used before serious fluid losses or deficits occur, and this is used to replace mild to moderate fluid losses due to diarrhea and other related condition. And if additional liquid is needed, water and other non-electrolyte fluids should be given. Okay, so this is the approved formulation of ORS. It contains sodium chloride. So there are three formulas: sodium chloride, acid. Okay, so So there are three combinations of ORS, that is sodium chloride contains sodium chloride, potassium chloride, sodium bicarbonate, sodium citrate and anhydrous glucose are used for the preparation of ORS. Okay, in Formula 1 sodium chloride, potassium chloride, sodium bicarbonate and glucose is used, and in Formula 2 is also same, but the concentration varies, that is the concentration of sodium chloride is higher and glucose, sodium chloride and sodium bicarbonate is higher and the concentration of glucose is lesser. In Formula 3 it contains sodium citrate and it does not contain sodium bicarbonate and anhydrous. Okay, so this is about electrolyte replenishment therapy. In summary to today's class, so electrolyte replenishment is preferred when there is excessive loss of water or electrolytes. So the excessive loss of water and electrolyte is a simultaneous process. That is, if there is a loss of water, electrolytes are also lost, and if there is a loss of electrolytes, then water will also be lost. And one more very important thing is excessive loss of electrolytes or water cannot be allowed unaddressed. It should not be left unaddressed. So immediate action should be taken or it can lead to fatality. And there are various ways how you are going to replenish the lost electrolytes and water. So the most preferred way is IV infusion of various preparations. Very commonly given IV infusion is normal saline. So, and if there is excessive loss, so you can use isotonic solution, and if there is excessive loss, hypertonic solution is used. And depending upon the loss, combination of electrolytes can be used, like sodium chloride and dextrose injection can be used. Different concentration, potassium replacement is also given. So calcium can be replaced by oral route or by giving injection in the form of ringer lactate and lactated ringer injection. So where potassium, sodium, calcium and lactate can be replaced from this combination of formulation. And the immediately how we can address for electrolyte loss is giving oral rehydration salts, that is ORS. So there are three formulas that I have provided. So, and ORS is most easily available, and if it is given, so the patient can be managed until he is that is until the clinician will attain, and it will also help in mild cases to replenish. Okay, so thank you so much. So this is about your today's class. In your next class we discuss about movement of water and